Hi there, and welcome to the Mindful Marathon podcast. I'm your host, Dr. Michelle Quirk, a run coach and pediatrician. Mindful Marathon is all about helping runners of all types to run their own race. Whether you are a seasoned runner or you're just getting started, I want to let you know that you're welcome here and that you're in the right place. Hi, everyone, and welcome back to the podcast. Today, I have a very special guest with me. I have Dr. Dapul, affectionately known as Dr. Gina by her patients. She is a board-certified adult and pediatric allergist and is the founder and CEO of Family Center for Allergy and Asthma in Rockville, Maryland, in the Washington, D.C. metropolitan area. She is passionate about providing personal, compassionate, and exceptional care for patients and families in her local community, helping them to breathe better and to live their best life. So, Dr. Gina, welcome to the podcast. I'm so happy to have you here.
For having me, Dr. Michelle. Can't wait to chat about all the things.
Yeah. So our topic today really is all around running with asthma and having asthma as a runner and all of these things. So, well,
Yes.
maybe tell us how you got interested in that to begin with before we get into some more specific questions.
Oh, yes. Great, great. So no, I have been, an allergist and allergies asthma specialist for 13 years in practice. And really what got me interested is because of family history as well as personal history.
Mhm.
And the interesting story behind the asthma component of things that has to do with running, actually, is that I was first diagnosed during residency, where I was coughing at night and couldn't figure it out. I ended up seeing a pulmonologist where I did my training in Brooklyn, and he diagnosed me with asthma. And then after a few follow-up visits, I asked him, I was like, my aunt has done a marathon and I'm interested in running. And he actually told me that long distance running is not for everybody.
Oh,
Yes. And I was like, oh. So then I was kind of disheartened for a little bit.
yeah.
And then after a few months of figuring out, like, I'm going to prove him wrong, I ended up then deciding I'm going to train for a half marathon and did that, in New York City and just got my asthma under control and then ended up being able to do multiple runs since then. So halves, 5Ks,
Wow.
10Ks, and one full. And so that has really fueled my passion to really not only help educate those who have asthma to say, look, you can do it. You just have to really have a great training team and great doctors to help you along the way so that I can be an inspiration to those who have allergies, who have asthma, and who want to live their life, whether you're, a runner, a triathlete, a century rider. Like it's all about being able to breathe and, do your activities because we want to enjoy the life that we have.
Yeah. No, I mean, what you say is near and dear to my heart. As you know, I'm a very allergic person myself, and I have some exercise-induced asthma as well. And I think part of the reason why I had trouble running when I was a kid was because of this, but it went undiagnosed and was kind of missed. And like,
Yes.
yeah, and so I just thought, like, well, I'm having trouble. I can't breathe and I can't
Mhm.
run. I'm just not good at it.
Mhm. Yes. But no, that's why until you realize, okay, this is what I could have, there's things that we could do about it, and then you can still do all your activities. That's the goal and the passion that I have behind what I do now.
Yeah, that's amazing. Now, and when we talk, okay, so for people listening out there, when we talk about
Mhm.
asthma in runners, can you explain a little bit of the physiology of what's happening and like why sometimes we would feel short of breath and what is going
Yes.
on?
Yes, exactly. No, so great start. So what's happening with asthma, with anybody in asthma, is that your airways narrow. And the mechanism behind this is that when you have, airway dehydration, right? We're running. This is from increased ventilation while we're running during this exercise. And it leads eventually to the release of what we call inflammatory mediators, which then cause bronchoconstriction or the airways to kind of close.
Hmm.
So that's what's happening where it's the, increased ventilation because of dry air, and then we're having the symptoms happen because of all this chemicals and stuff that's being released.
Yeah. And what kind of symptoms are people feeling? I mean, I know how I was feeling, but what things
Yes.
do people tell you?
So it's really three main ones, which are shortness of breath.
Mhm.
You can be coughing, and you can also have chest tightness. Sometimes patients may also report a wheeze. So that's a whistling sound. I'm going to actually do it for you because I can actually do that. It's on cue, which is so if you hear that whistling kind of sound, that's also another potential symptom. But typically, shortness of breath, chest tightness, and cough.
Yeah, yeah. And I guess, back to your original story and mine too, we have proven people wrong that like
Mhm.
with asthma we can run, but is it safe for those with asthma? I mean, how can we approach this? Like, are there different levels of asthma? Do we need to worry if we have severe asthma? Like what can we do to make sure that we're running safely even though, we have asthma?
Yes, no, great question. And the main thing I would hope that your audience takes away from it is if you have asthma, you can accomplish anything, right? But you need to have a good management plan. And that's why it's great to work with your doctors, your coaches, to make sure that you understand what your symptoms are, what are the triggers for it, and then come up with the plan to either prevent your symptoms before you start your run or other daily medications that you might take on a daily basis to prevent your asthma symptoms on a regular basis so that the running, which is a potential trigger for asthma, doesn't cause those symptoms. So it's all about finding a good management plan to prevent your symptoms.
Yeah, I think, what you say really hits home in my work as a pediatrician. What I often tell kids, because they will say like, well, can I do this or can I do that? And I say, well, ideally you should be able to do all of those things. If you're not able to do them, then I'm not doing a great job controlling it.
Exactly. That's exactly what I say too. I'm like, my goal is to help you breathe out there and do all the things, whether it's you're playing soccer or running track or, participating in your sports. That's our goal as the physicians taking care of patients with these conditions. It's so that we help manage and prevent that so they can do their thing.
Yes, exactly. Now, when we talk about having asthma that is well controlled, in
Mhm.
terms of like, I'm thinking about the way that we diagnose it and how we step up care and
Therapy.
asthma action plans and
Yes.
all of these things. But what is well-controlled asthma and like, should we be having symptoms never kind of thing? Or
Yes. So essentially, it's almost that your symptoms are prevented because the medication or the treatment plan that you're on is helping to prevent the development of your symptoms.
Mhm.
So that's what well-controlled asthma is. It means that you can get through your run without developing the shortness of breath, the coughing, or the chest tightness, that you can complete whatever activity you have without having something pop up, which then means you need your rescue inhaler,
Mhm.
right? So well-controlled asthma is having a good plan to prevent your symptoms so that you can complete whatever that activity or that run is.
Yeah. Yeah, that's great advice. And if we normally so we get to this ideal of having well-controlled asthma, at what point do we need to pause and say, maybe I need to get in and see my doctor, reassess some things if we're starting to have symptoms again? What does that look like?
Yes. So, in terms of the different medications that are out there too, I think this is a good segue to talking about that. There are rescue short-acting medications, right? So, those are your things like albuterol or levalbuterol, and that will temporarily open up your airways. Right. So we may recommend to some patients, oh, take it 5 to 10 minutes before you exercise, and that will prevent your symptoms. But if you end up needing to use that quite frequently, or you don't know what time of day you're going to run, then it's worth talking to your physician, your provider about, well, I might work out 5 or 6 days a week, right? Depending on how often you're training or how often you're running. And you don't want to prevent your symptoms each time that way. So it's probably worth speaking to them about, well, do I need a preventative controller medication so that on a daily basis, your breathing and your symptoms are stabilized so that it's not popping up to say, oh, I've got a symptom and I have to control it. Oh, I've got a symptom, I have to control it. There's different ways and different medications, whether there's tablets like, Montelukast or leukotriene antagonists. There's inhalers that you take on a more daily basis. So depending on your symptoms and when you break through, there's different regimens for you and your physician to talk about so that for you, it's preventing the symptoms so that, yes, you have your plan. And then if you break through from that, you're still able to speak to them and say, look, I still had to use my rescue this many days a week. Is there something else that we can do? Because now with all our different inhalers, there's single agents, there's double agents, there's triple agents if necessary, right? So depending on how severe the symptoms are, but only until you find a good baseline, like, oh, this is what I can do. And then, oh, I have a breakthrough symptom that working with your, doctor and provider will help you figure out, well, when do I need more than what I'm currently taking?
Yeah, yeah. There's a lot to know, and there's a lot of different, I mean, the good news is there are a lot of different medications to help manage
Yes.
this, and everybody has,
Hmm.
everybody is an experiment of one, and you have to figure
Yes.
out
Figure out for your, yes, for
what
you,
works for
what
you.
works. Exactly,
Yeah.
exactly.
Could you speak a little bit to like the triggers that people have? Because I know, we talk about like exercise-induced asthma, where, okay,
Mhm.
we have a specific kind that really is only happening when we're running, or maybe only running in like cold weather. But a lot of
Mhm.
people have triggers, all sorts of different triggers for asthma in addition to that.
Yes, yes. So no, on a regular basis, like if you have underlying asthma, right? So there's inflammation in your airways, and what happens is something causes it to go, and then you have your symptoms. So other triggers can include things like upper respiratory infections, like viruses, right? Right now we're in the whole like flu and cold season as the time of this recording. So upper respiratory infections can cause some asthma triggers. Exercise is another one. Other ones can be pollen. So for those who have seasonal allergies, if you run outside during the peak of pollen season in March, April, May, June, you might have some worsening symptoms than if you ran in November, December when it's a little bit colder. Um, Other triggers also, as you alluded to, Dr. Michelle, are cold air. So for some patients, it's that cold air that can also cause the airways to clamp down. And so some of the things that we may recommend, for things like that are, especially right now where we're at in the middle of winter, are to consider wearing like a loosely fitting scarf or a mask to help warm the air or humidify the air that you're breathing in, because cold air, you just go straight out and you're running, it's like, whoop, and
Yeah.
then we start having symptoms. So being mindful of what is your trigger that triggers your asthma, again, whether it's a virus, pollen, even pet dander, um, and cold air, exercise. So many different things. Oh, for some people too, it can be air pollution,
Yeah.
when there's the wildfires coming down. So being outdoors during that time of day. So all these different things that can cause your airways to close down. You want to be very mindful of what your triggers are so that you can, take steps to prevent that.
Yeah, yeah. No, there's a lot to know here, and there's a lot to know about yourself. So,
Mhm.
I mean, the good thing is that, there are so many different options, and there are different measures we can take to
Yes.
to be to be putting ourselves in the best place possible when
Hmm.
we go out for the run. But like, there's a lot to
Yes.
know. But that's why
Hmm.
I wanted to talk to you.
Yes, exactly.
No, we talked about, so specifically for the cold, like I like the advice to, kind of get a face covering, like to
Hmm.
keep things moist
Yes.
and a little bit warmer. Are there other like adaptations for training that we can take if we have asthma, like things, I mean, as the coach, I'm always the person saying like slow down and make sure your level of effort feels comfortable, like all of
Yes.
those things, which is true for anybody, but especially if you have asthma, but other training adaptations that you could speak to from your own personal experience, but then also, as
Yes,
an
professionally.
allergist.
Yes, yes. So, one of the things that I talk about with patients is proper warm up.
Mhm.
So, being able to warm up and get your body used to everything as opposed to just going straight out. So that's one consideration. The second one is, again, since breathing cold air can cause your airways to have the symptoms, that's why wearing this face covering would be a second one that I would recommend. A third one would be if you, again, you are allergic and you're like, okay, I know pollen season is not the best time for me, then you want to take into consideration during peak pollen season, possibly either running indoors, if that's an option for you, or running early in the morning or late afternoon, early evening, because that's when pollen is less. So
Hmm.
you really don't want to run during morning and midday because that's when pollen is highest. So those are for patients, again, who have the pollen allergy. And then if you are, in an urban setting and you're trying to run there, some of the things to consider is schedule your run outdoors, maybe during low traffic hours
Hmm.
because air pollution and all the stuff out there can also potentially trigger it, as we were talking about earlier. So it's really, as again, being mindful of your triggers and then finding ways to adapt and accommodate so that you can still go outside or train indoors, depending on the time of the year or what's outside.
Yeah, no, it's great advice. And I know we're not in spring, although we will be there soon, but
Shortly.
I know, a while ago, I interviewed one of your allergy colleagues, Dr. Karen Kaufman, all about like specifically running in the spring and
Right.
running in pollen season. And
Yes.
yes, like there's some overlap here, but we didn't specifically talk about asthma then. So anyway,
Mhm.
I'll leave that
Yes.
link below in the show notes so you can listen to that one right after this if you're in that state of mind.
Mhm.
But yeah, I know. There's just a lot to know and a lot to prepare for. That's all.
Mhm. Yes.
Now, what about, so I do have some runners who are very fearful. So they have asthma and they're very fearful to run, or like us, we were kind of told like maybe you shouldn't
To
run, or
do
like
this.
that's not like a great sport for you.
Yes.
So, what advice do you have for them? I feel like we want to leave people with a lot of hope, which you already are doing, but
Yes.
what advice do you have for those out there listening who are like scratching their head like, well, I was told not to do this.
Yes. And so for your audience and listeners who are in that position, I would say something you can do is actually start small, right? And then also find, as we're talking about this whole entire time, a team who is willing to support you, right? So clearly I couldn't go back to the pulmonologist and say, I'm going to run this half marathon, right? But the idea is to find the people who will be supportive of you because then you can change your mindset on, oh, I can do this. And having those little support group, support people, and then you and your mind training yourself to say, oh, look, I can do this. Or there are examples of people who can accomplish this. And then you can say, oh, well, maybe I'm not going to go do a full marathon right now, but we can start off with a 5K
Hmm.
and make that an event. I know some of your previous speakers and guests also talked about that. And I was like, oh, that's a fabulous idea, right? You just go with your family or you sign up for a 5K a couple months out, and then it's a goal for you to be able to accomplish. And after the 5K, you might say, oh, I might try to 10K, or you just never know where it takes you. So the idea is to start.
Yes.
But really, it starts in your mind. And so if you can say, I can do this, the universe conspires so that you're going to be able to do this. And if it leads you to people and doctors who will support you in that, then I would say find those people and listen to, your previous episodes because it's really inspiring to say, look, we can do this. These are what we can do for base running, and establishing that. And so your podcast is really helpful for those of us who need that support and those tidbits on, oh, how can I do this? So yes, that's what I would say, which is I want to super encourage you to think you can do it and then find the people who will support you because you can.
Yeah, no, no, it's great advice. And I appreciate too, as you were talking, like a lot of people simply their mind goes to, well, I can't do this, or they have been told that they can't do it.
Yes.
And our mentor, Dr. Una, her question is always, instead of I can't do this, it's how can
How
I?
can I?
How can
Exactly.
I? And I
Exactly.
think that really that makes a lot of sense. I think a lot of times there are so many barriers to it, and it's much easier to just say, okay, it's safer not to,
Yes.
and so I won't.
Hmm. Yes, but at the same time with that, it's almost thinking about, well, will you regret it if you don't give yourself that option to say, oh, well, what if I try it and see how I do? Because really there's, as you've talked about, so many benefits to running
Yeah.
and even walking running or whatever the combination that you're going to do is that sometimes it's worth just giving it a try and seeing how you feel from that experience. That really there's no just doing it once. It's kind of like, wow, I can do that. And you just keep going for more.
Yeah, yeah. And if you've been listening to the podcast for any length of time, like we talk about starting wherever you're at. And I have
Hmm.
a lot of clients who use the run walk method, as you were alluding
Hmm.
to. And like that is
Yes.
a great way in to figure out your level of effort. And especially if you have asthma, it's a way for you
Yes.
to like kind of assess, like, okay, how am I doing? And I have these scheduled walk breaks where
Walks.
I can
Exactly.
recover.
Yes. Yes.
So, yes, it makes a
It's
lot of
not
sense.
running like the whole entire time. It's like,
Right.
oh, there's ways.
We're not saying go out and run the marathon tomorrow.
Yes.
You can get there if you want to. No, okay. Well, let's see. I think we tackled a lot of the questions that I have had personally and also from a lot of my athletes.
Hmm.
What is one thing you wish every runner with asthma knew?
So I think we covered it, Dr. Michelle, which is really knowing that if you want to run, you can do it. It's really finding a management plan that works for you, whether it's your rescue, whether it's preventative medicines, and then recognizing that whatever you put your mind to, you will accomplish it because it ends up being that something that you want to do for whatever that reason is. And I really just hope to encourage everyone to say, look, I have asthma, but so does everybody else, and they're
Yes.
running too. And for me, that's my motivating factor for my patients when they see when I post on like, my Instagram, I'm like, look, I just completed this. And sometimes actually I've seen my patients as I cross the finish line and I'm like, look, you made it. And it's
Yeah.
just so gratifying and so satisfying to say, look, we can do this. And I'm high-fiving patients across the, finish line. And it's really something where if you think you can't do it, you're not going to do it. But we're here to tell you that you can and to really help support you and say, you just have to find that way. And how can I accomplish this? So really just giving you, hope, especially as we come upon, this new year and just knowing that you can accomplish it and to not let anything stop you if that's what you want to do.
Yeah, yeah, and you give me a great idea that I don't think I've ever posted myself using my inhaler, but I definitely
Oh.
use it before races in the cold. If I'm doing
Mhm.
an easy run, I tend to be fine, even in the winter.
Mhm.
But if I am really going race pace, like a 5K in the cold, I definitely
Mhm.
need it. And so, yeah, I never thought to post it, but that makes a lot of sense. And that would, yeah. So, yes, I am a person who uses albuterol sometimes as well.
Mhm. Yeah.
It works wonders.
Mhm.
Yes. Well, Dr. Gina, thank you so much. This has been very full of hope and very enlightening. And I think that it will resonate with a lot of the listeners out there. So thank you for joining us.
Oh, thank you for having me, Dr. Michelle. This was such a fun discussion, and hopefully, yes, your listeners will take something away from it.
Oh, for sure. And tell everyone where they can find you, especially if they are in, your local area.
Oh, yes. So you can find me online on our website at dapul.allergy.com. That's DAPULALLERGY.com. Or you can follow me on Instagram and Facebook and YouTube at drdapul.allergy. And yes, you can see all the things about allergies and asthma there.
And some running content as well.
Yes.
Yay! All right. Well, thank you so much. And I will leave all those links below so everybody you can go and follow Dr. Gina's adventures and get in touch with her if you're in the DC, Maryland, Northern
Mhm.
Virginia area.
Yes. Thank you.
Yeah, thanks everybody for listening, and we will see you next week. Thank you for listening today. If you enjoyed the episode, please share it with a friend. And if you have a moment, please rate and review the podcast so that we can reach and encourage others to tie on their sneakers and join us out there on a run. See you next time.